Hello, Assalamualaikum and salam UiTM di hatiku. Coronavirus disease that is also known as COVID-19 is transmittable disease. In this report, we will be focusing on the chosen country which is Myanmar. Myanmar is located on the west side of Southeast Asia and also known as Burma. These are some of the reasons Myanmar was chosen as the primary objective of our discussion is the country approach to preventing the disease from spreading throughout the nation. This also includes a flaw in their strategy to protect their people from infected, as well as frontliner personnel such as soldiers. I will continue. Soldiers Myanmar has suffered a significant deep recession as a consequence of COVID-19. Despite their effort to defend and sacrifice for the country and its people, whenever they were infected with the virus, they received completely insufficiency treatment while experiencing symptoms without a help and support of expert or medical devices. According to Myanmar now, at least 10 military men and their relatives had died per day at a military hospital in Mandalay, owing to a lack of oxygen and doctors. Military leaders have little regard for the general public or lower ranks. During the COVID-19 pandemic, it's become clear that they are being overlooked.
Despite all the action taken to prevent the spreading of COVID-19, the outbreak continues and many civilians suffered. Soldiers affected received insufficient treatment, causing them to suffer the symptoms. Despite all the positive action taken, there are a few controversies that follows. Most of these controversies surrounds the Myanmar's military following the change in Myanmar's political position. There are attempts to weaponize COVID-19, jail, attack and accuse many healthcare personnel and confiscating medical equipment. This had affected Myanmar's medical healthcare ability to quickly treat and further stopping the spread of the pandemic.
Myanmar responded early to impending COVID-19 breakout with the formation of Inter-Ministerial Working Committee a few days before the World Health Organization (WHO) declared it as a global health emergency. This was followed by setting up the National Center Committee to prevent, control and treat COVID-19, chaired by the State Councillor Aung San Suu Kyi. It aimed at smoothing out and fast-tracking activities at the central level, such as case investigation and management, providing community awareness, and disseminating updates regarding the pandemic, and securing funding, procurement of essential medicine and equipment in time. Following the first two cases, strict containment measures were put in place which included travel restriction, partial lockdowns, closure of major businesses, quarantine incoming travelers, banning gatherings, imposing stay-at-home orders, and curfew in some major cities. The State Councillor appeared constantly on television encouraging the public to bravely face the pandemic and urged them to follow the public health advice provided by the Ministry of Health and Sports. Myanmar's health sector is already challenged by common health problems faced in the developing countries, including a shortage of skilled healthcare workers and underfunded health infrastructure. Myanmar's healthcare consistently ranks the world lowest and it was included in 57 countries facing critical health workforce shortage. The healthcare workers have been affected heavily by COVID-19 compared to other professions, as they are directly responsible for the well-being of patients.
So, as COVID-19 has expanded globally, WHO World Health Organization has issued global guidelines which each nation has amended and aligned with their unique environment and requirements to limit or manage COVID-19 incidents in their country. The healthcare management must ensure that all patients receive an examination to detect the symptoms as to recognizing the COVID-19, which determined by the infection's clinical spectrum, and each severity level involves distinct management, illness progression risk, and therapy options. There are also general precautions and infection prevention control measures such as waste management that have been provided for patients by healthcare, including providing infographic on the latest information systematically about COVID-19 cases, precaution, prevention, and vaccines.
In conclusion, Myanmar can be taken as an example for how fast the country responded to the COVID-19 outbreak before it was declared a global health emergency. They are quick in initiating community awareness, investigating and managing COVID-19 cases, and disseminate pandemic updates. Myanmar also had established a home-based care that follows the WHO guidelines.